And today, on this World Stroke Day, we have Dr. Praveen Gupta, Chairman, Marengo Asia Institute, International Institute of Neurosciences, for an insightful discussion about stroke. Welcome to the show, sir.
Thank you, Dr. Vishta, for having this discussion on this very important occasion of the World Stroke Day.
Yes, sir. So, sir, let us start by helping our viewers understand in layman terms about what is stroke actually.
So, generally, when we talk of stroke, stroke is usually referred to two different types of conditions in the brain which result in paralysis in the body.
Okay.
One is obstruction to the blood supply of the brain, which causes brain cells to die.
Okay.
What we call as a clot and sometimes which causes hemorrhage or leakage of blood in the brain, which is what we call as brain hemorrhage.
Okay.
Sometimes stroke is referred to as both conditions, and occasionally, when we refer to stroke, we refer to the ischemic stroke as
Okay.
stroke or clot as stroke and
Okay.
brain hemorrhage as hemorrhage.
Okay. Can you hear me, sir?
I can hear you well, very well.
Okay. So, sir,
Yes, I can hear
what?
you now.
Yeah. What are the first two signs a bystander should notice in somebody who is undergoing an attack of stroke?
So we have coined an acronym called Be Fast, which
Okay.
emphasizes the rapidity of care also and is easy to remember for knowing the signs. B stands for balance.
Okay.
E stands for vision or eye movements.
Mm-hmm.
F stands for facial drooping or drooping of face.
Okay.
A stands for inability to raise the arm.
Okay.
S stands for slurring of speech and T stands for time.
Okay.
So, if you are having any of these symptoms acutely, you are experiencing a brain stroke.
Okay.
That means it is time to act because we say time is brain. The sooner you access treatment, more brain cells we can salvage.
Great, sir. Great to know. So, sir, most of the time there is a delay in calling the medical or reaching the hospital or calling the emergency services. People take it as normal fatigue. Maybe it is low blood sugar. Maybe I'll feel better after resting, or I don't want to bother anyone. So, um, I want to know more about, I want you to tell more about this to the viewer so that they can be aware that they are now undergoing a stroke and not neglect the signs.
See, once you have any signs of loss of function or abnormal function on a part of the body, that means something is going on in the brain.
Yes.
Now, when you have occlusion of blood supply to the brain, every seconds,
Yeah.
thousands of brain cells are dying.
Okay.
Which mean that if you are waiting for 1 hour कि ये अपने आप ठीक हो जाएगा, it will get well by itself, in that 1 hour, countless cells have died.
Oh.
Which means if you rapidly access and make a proper diagnosis, and in case you are having a stroke, we can open the artery in time, we can salvage your brain and restore you to normal health.
Okay.
At worst, what will happen? It will not turn out to be a stroke and you will
Yeah.
remain all okay.
Yes.
But the worst thing would be that you're having a stroke and because of neglect
Yeah.
and delay in time, you will not be able to access
Yeah.
the proper stroke treatment due to delay in presentation to the hospital, which is not good.
So this is a big message to our viewers that any signs and symptoms which is leading to dysfunction or imbalance or slurring of speech or there is some asymmetry on the face, they should not neglect it and immediately seek medical attention.
Absolutely.
Yes. So, sir, we have now seeing a trend in rise of stroke incidents, especially in younger and healthy individuals who potentially do not have any symptoms of high blood pressure or high cholesterol. They keep themselves very well, they go to the gym, exercise. So what are the potential reasons for that?
So one of the largest causes of stroke now is increase in smoking and vaping.
Ah, okay.
Smoking and vaping are very, very strong risk factors for stroke. So is excessive alcohol intake. Third thing that is increasing the risk of stroke is sleep apnea or lack of sleep. Both causes hormonal imbalance inside the body, giving rise to increased incidence of stroke. Fourth is sedentary lifestyle, which causes accumulation of fat and metabolic syndrome,
Okay.
giving rise to cholesterol deposition in the arteries, giving rise to stroke.
Okay.
So, imbalance in lifestyle is a major cause of stroke in young people, even if they are not diabetic or hypertensive.
Okay, that's very insightful, sir. So, sir, as you said, sleep apnea. Nowadays, there is actually a very high trend that people are not sleeping well. You know, the sleeping hours have reduced to 4 to 5 hours. So, how does that directly? It may not cause any immediate effect to one's health, but I'm sure it might have a prolonged effect. And I want you to put more insight on that.
So, sleep is body's natural mechanism for rest and restoration and rejuvenation. All the repair of the body, all the repair of the inflammation in the body, wear and tear of the body happens in sleep. The memory consolidation happens in sleep,
Yeah.
and our inflammatory hormones like steroids, natural steroids, cortisol, adrenaline, they all become low level in slow wave or deep sleep.
Yeah. Okay.
When we don't sleep well, these hormones are perpetually on the rise,
On the higher
which
side.
means your overall cortisol secretion is higher, your adrenal secretion is higher, which means higher heart rate, higher blood pressure, higher incidence of diabetes, higher incidence of high cholesterol, which actually means higher incidence of stroke.
Yes.
So,
Yes.
lack of sleep translates into a significantly higher incidence of stroke.
So, sir, as you rightly said, there is high level. I mean, the cortisol levels goes high when you don't sleep much. But yes, in today's lifestyle, stress is something which is inevitable, and it is there in younger population, middle aged population, higher age population. Stress is like a part of our lives now. So, and obviously that leads to lack of sleep also. So what is that? I mean, should people consider supplements to help them, relax? What is your take on that?
See, managing stress in today's fast paced world is very, very important.
Mm-hmm.
Everybody will get the same pressures of work, life, balancing, social media, but we all handle it differently. We have to individualize our own life.
Yes.
We have to maintain a regular lifestyle of exercise, balanced diet, learn to maintain and rationalize what are my needs, what
Yes.
will make me happy. Unfortunately, a lot of us are focused on what is making other people happy.
Absolutely,
What
sir. So true.
are they doing in their life rather than trying to understand what I want to do with my life.
Yeah.
The moment we will bring ourselves to the unique awareness of our own life, if we are less stressed, we'll sleep better. If we sleep better, our next day will be better. So it is a positive cycle of change that we can multiple other disorders in the body.
Yes. So, sir, I mean, this is something related to sleep only. One more question to you. So, if somebody is not getting proper sleep, so is it advisable for them to take any supplements which can help them, sleep for at least 6 to 7 hours a day? Can you hear me, sir? Sir, can you hear me?
So are we back, Vijita? Can you hear us?
Yes. Yes, I can hear you, sir, very
Very,
good.
very good, Dr. Vijita.
So, sir, as I was asking you, since as we were discussing about stress and lifestyle management, and people are not naturally getting the required window of sleep that must be there for a healthy lifestyle. So, should people take any kind of supplements to actually get a good sleep? Is it advisable by you?
So a lot of people take magnesium supplements to relax the brain, and a lot
Mm-hmm.
of people take over-the-counter melatonin hormones, which are available,
Yeah.
which are natural sleep hormones. But to address your sleep problem, you don't need these things. You need what is known as sleep hygiene.
Okay.
Sleep
That's
hygiene is basically certain practices that you must do to ensure good quality sleep.
yeah.
The first thing is before going to bed, you must shut down your brain.
Absolutely.
Like you shut down a laptop and
Hmm.
save changes to your daily routine in a laptop before you shut it down. It takes a few minutes for it to shut down.
Mm-hmm.
You have to shut down the ongoing mental activity before going to bed.
Yes.
That is only meant to sleep. Your place should be comfortable, dim light as
Yeah.
much as you want, no noise. You should not be playing on social media while going to bed because that will cause dopamine spikes which will take away your sleep.
Yeah. Mm-hmm.
You should be relaxed. You should not exercise immediately before sleep. Should not eat heavily before sleep.
Yeah.
If you do all these things, your sleep quality will spontaneously improve and you will get better.
Great, sir. That was a very good term that you coined, sleep hygiene, which has to be taken care by the individuals these days. And also, as you mentioned, as we take care of our gadgets, we should take care of our body, which is the biggest motor device that we have within ourselves.
Absolutely.
Yes. So, sir, how can one tell that you are getting a stroke, or it is simply a dizziness episode? Because most of the people, because of some compression in their neck, do get dizziness episodes frequently. Okay. And then obviously the symptoms of stroke sometimes do not come up very evidently, and they are just stuck to normal headaches or dizziness. So how can someone differentiate, a common man differentiate between the two?
So normally dizziness can be caused by ear canal imbalance called BPPV or vestibular neuritis, sometimes because of cervical issues
Yeah.
also.
Yeah.
But when the dizziness comes from brain, it is accompanied by slurring of speech
Oh, okay.
or facial deviation,
Okay.
any change in vision, balance, standing difficulty or walking difficulty or tilting to one side, that means it could be a brain stroke and it is emergency and time to act immediately.
Okay, I completely understand, sir. So, sir, what is new about risk management of stroke on this World Stroke Day?
See, the World Stroke Day theme basically translates to every second counts. When you
Okay.
have stroke, every second counts, but the basic things about stroke prevention and lifestyle management that are very, very important are eat food on time, eat a diet which is less in fats and carbohydrates and
Yes.
rich in seafood,
Okay.
fruits, vegetables, and whole grains, and nuts like almond and walnut.
Okay.
Have adequate 6 to 8 hours of sleep, which is very, very important.
Yeah.
Exercise 150 minutes a week daily. So, the other thing is you should do measure your BP and sugar regularly, undertake health checks every 6 months so that you can avoid building hobbies,
Yes.
and you should use social media very carefully and
Yeah. Is there an internet issue there at the office?
No, we are fine. It's I think Dr. Praveen Gupta is having some internet problem in the office. That's great.
Yes.
Yeah.
Let me just call him again. Sir, am I audible to you?
You are audible, Dr. Vishta.
Okay. So, sir, continuing with our talks, you were mentioning about frequent screening of health checkups. I mean, health checkup screening with people should do that, But individual, especially the younger
Yes.
population, they do not do it like at the age of 25, 30, 35 because of their schedules. So, what do you recommend to them? Because at this age, nobody thinks that they will get a stroke, but obviously their lifestyle uh, predisposes their risk to stroke.
So these days, first of all, increased significantly at this point of time as we talk. We all know that in younger population, before a stroke happens, the cholesterol
Okay.
deposition in the artery start 2 decades before the stroke happens. Which means that
Oh,
if we can
okay.
intervene on our lifestyle much earlier than the date when the stroke will happen, we will be able to actually prevent a stroke without medication. Which means
That's
that to do a health screening regularly, even for younger people, can help them prevent occurrence of many disorders like stroke and heart attack.
thank you, sir. Thank you. That was really insightful. Sir, is there a genetic predisposition to stroke?
There are clear-cut genetic risk factors as family history is a major risk of stroke. Homocysteine metabolism and changes in the homocysteine genes or enzymes that catalyze homocysteine are very important cause of elevated homocysteine, which is a major risk factor for stroke.
Okay.
So our genetics plays a huge role and often we cannot modify them. But
Yes.
knowing that our genetics predisposes us to a stroke, we can control our modifiable risk factors
Okay.
and that helps to reduce the genetic risk of stroke.
Okay. So, sir, what is the golden window period for a person to help to get immediate acute medical care when they spot the signs of stroke?
See, within 4.5 hours of the onset of stroke and with certain criteria on MRI in strokes on awakening, we can give injections to reverse the stroke, which is called thrombolysis.
Okay.
But in
Okay.
other patients who drain, we can also remove clots by doing mechanical thrombectomy. We can physically remove clots from the brains up to 16 to 24 hours also. That
Okay.
is why when you have a stroke, it is important to access a stroke ready center like ours so that even outside the first few hours, if you are eligible, you can get the best acute stroke care.
Okay. So, sir, in urban population, we have access to centers like Marengo Asia, I mean, Institute and other major institute which are stroke care centers immediately near to the vicinity of your stay. But in rural areas, we find it very difficult for people to reach the acute stroke care in that golden period. So, what is that the person can do, or they how do they manage during that crisis?
See, the government is doing a lot today, and government is setting up CT scan facilities in all district hospitals. In
Okay.
fact, in many district hospitals, we are having stroke can be diagnosed and treated available. On a at Marengo Asia hospitals, we are happy to help people set up centers for acute
Okay.
stroke treatment and mentor them and guide them and maybe on a phone call also we can help those people provide acute stroke treatments.
Okay, I got your point, sir. So, sir, as you said, blood pressure is a big contributing factor for occurrence of stroke in later part. I have seen in my practice as well, a lot of people do not take their recommended dose of blood pressure medications, fearing side effects. So, what is the advice that you want to give to our viewers on the same?
See, thing is, allopathic medicine, the beauty of allopathic medicine is that all side effects are known devils.
Yes,
And
yes.
most of the allopathic medicine pass rigorous testing, so they do not damage their organs.
Okay.
Similar mild side effects can happen to some people, but your doctor will know the side effect and how to change the medicine to avoid or mitigate that side effects.
Okay.
However, like a water pipe, if it is put under water with high pressure, the pipe will burst very soon. If
Yes.
your body's arteries have to pump blood against higher pressure, they will degenerate and they will either collapse or they will explode, which means the total side effect of living under high pressure is
Okay.
significantly higher than any feared side effect of blood pressure medications.
Okay. 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 So, sir, I want you to give some insights for our viewers on what happens during the acute medical care at the hospital during stroke. I mean, there are two types of management. One is medical management, which is more than 80% of the case, and one is surgical management. So, I want you to give more insight for our viewers to understand the same. Sir, could you hear me?
Can you hear me? Yes, I can hear you.
So, sir, I was asking that
Yes.
I
So I
wanted
was
you.
saying,
Yeah, please continue,
no,
sir.
no, please.
So,
So I
sir,
was saying that the
yes.
potential harm of blood pressure is so high
Uh-huh.
that we should not even consider minor side effect of blood pressure medications and take them appropriately, adequately, and fearlessly. Also, blood pressure does not have any symptoms and it is a silent killer.
Yes.
So, if you don't have any symptoms, don't think my blood pressure is fine and I don't have to worry. It is something that requires regular checkup.
Okay, okay. So, sir, I want you to now give some insights. Like we have now discussed about the signs and symptoms of stroke and what are the healthy lifestyle that one should follow. Now, if somebody has stroke, so the it will be very insightful for our viewers to know what happens during the acute management of stroke at the hospital. So there are two types, as you said rightly. One is mostly medical management, that is 80% of the case, and one sometimes the person has to go undergo a surgical management. So what happens in these two scenarios?
So, clearly, when a person with acute stroke comes to our hospital, we announce what is known as code stroke,
Okay.
which means all the people who are involved in stroke care immediately know that there is a stroke patient in the emergency and they are on high alert, and relevant people rush to the emergency to take care of the patient.
Okay.
The MRI team is alerted and the patient undergoes brain imaging to differentiate between the hemorrhage and ischemic stroke. By MRI, sometimes we can find whether the stroke is old or new, whether a large artery is obstructed or not. If you are
Okay.
within 4.5 hours and you fulfill the criteria for taking medicine which can burst the clot, we have readily available medicines to burst the clot that we can give, which can
Okay.
thrombolize you.
Okay.
And then you are shifted to the ICU for intensive neuro monitoring,
Okay.
where your pulse, blood pressure, and sugar are kept under regular check. Suppose you have a brain hemorrhage on the scan, then we cannot give you a medicine to thin the blood. In that case, if you are taking something that is causing the bleeding, we reverse the effect of that medication by giving antidotes. If bleeding is small and the patient is conscious, we do not operate immediately and we observe and give medical management.
Okay.
If the bleeding is large or it is causing pressure in the brain, we operate a lot of times.
Okay.
And sometimes we do angiography to find out why did the vessel rupture and find things like aneurysms and arteriovenous malformations that can treated by doing angiographic coiling or glue insertion.
Okay. So, sir, we find a lot of people who have had cardiac issues in the past, like myocardial infarction or any kind of such issues.
Yes.
Are they at higher risk of stroke because of the medicines, because of the prolonged use of certain kind of drugs?
So, heart attack and stroke are very similar illnesses.
Okay.
People who are at risk for heart attack are also at risk for stroke. So, on the contrary to the fear of heart attack medicines causing stroke, heart attack medicines actually reduce the risk of ischemic stroke.
Okay.
But
Okay.
sometimes when you are on very large dose of blood thinners, you can get more risk of hemorrhage in the brain. So that is
Yes.
why it is your doctor who will balance the adequate amount of blood thinner which will prevent a ischemic stroke and
Yeah.
which will not predispose you to brain hemorrhage.
Okay. So that means somebody who has suffered stroke should periodically keep visiting their concerned doctor every 3 months for a complete checkup so that they know what is going on, and the doctor can guide them on the course further.
Absolutely, Dr. Vichta. As important is the treatment of acute stroke, so is the importance of stroke prevention. So we
Yes.
should monitor patients post-stroke so that we can know whether their parameters are maintained in the right state or they are going out of their range. So
Yeah.
we can all work together with patients to control these risk factors and enhance the preventive ability of our stroke patients.
Yes. So, sir, now let us come to the recovery post stroke. Now, once the patient is discharged from the acute medical care, what is the most important thing that the patient should undergo to come back to functional independence after such a catastrophic incident? I
Very,
want you to throw some lights on the rehabilitation part of stroke.
yeah. So very, very relevant question, Dr. Vichta. One, I want to tell our viewers that there is no date where stroke will stop improving.
Yes.
Stroke is one-time illness injury to the brain, and it can continue to improve for many years. So
Yes.
post-stroke, we can do medical rehab by giving medicines to reduce spasticity, improve pain, improve speech, and mental function. But the role of rehabilitation is significantly important because rehabilitation provides the brain very important feedback which stimulates the neuroplasticity in the brain to regain function, power, ability, and independence. So, appropriate stroke rehab in a setting where a neurologist and rehab specialist work together to
Yes.
tailor precise therapies for individual patients is very, very important to achieve the goal of independent functioning.
True, sir. So, sir, how long typically uh, does recovery post stroke take?
So it is different for different individuals and based on site and location of stroke, but it usually starts after 3 days. It can take 7 days or 3 weeks in some people
Yeah.
and continues for months.
Yes.
The important thing is to employ the rehabilitation experts to do clear target and goal setting for you.
Yes.
Also to learn exercises yourself or your family. So once the physiotherapist has left, later in the day you can do those exercises themselves or yourselves along with the medications to enhance the brain function that can help to fasten up the recovery from stroke.
Yes. So, sir, we both understand that a lot of people think that, if about 3 to 4 months have passed post stroke, the recovery is impossible. And that this is the biggest myth that people have in their minds. So, I want you to throw some light on that.
In the Marengo Asia Rehabilitation Center or Marengo Asia Institute of Rehabilitation Technology, we are actually devised various therapies like coma stimulation therapy, combined neuroscience-based rehab, where we stimulate brain transmitters to become active so that we are able to increase neuroplasticity to a level where a stunned brain or a brain that was not functioning can start to function. So, combination of neurological plus physical rehab
Yes.
is paramount to restoring ability and
Yes.
independent functioning after an acute stroke.
Yes. So, sir, a person who has had a very active lifestyle suddenly with the when the stroke strikes, he's dependent, he or she is dependent, so it creates a lot of mental pressure on the patient. So there are incidents of patients going into depression after stroke. So what do you a comprehensive approach to the recovery post stroke in the rehabilitation part is very very important. I want you to throw some light on that.
Dr. Vishta, you have brought up a very important fact. About 30% people post stroke have sleep problems or they can undergo clinical depression.
Yes.
It is very important to recognize this trait because in depressions, people do not exercise properly.
Yeah.
They are not able to provide the component from their side which is required for rehabilitation and therapy to succeed. That is
Yes.
why at our institute we try to combine the neurological and the psychological assessment with the rehab
Yes.
so that the counseling, the medication part can also be taken along with the physical rehabilitation part and
Yes.
patients can receive wholesome benefit.
True, sir. Sir, also, uh, like we find that most of the people do not come to structured rehabilitation centers. Instead they take a 1 hour physiotherapy, a basic physiotherapy at their homes, and the rest 22 to 23 hours of the day they do not do anything. So that doesn't give any result for the patient to get independent after stroke. So how important it is for patients to come to a structured neuro rehab center per se to get the rehabilitation done after stroke.
So it is very, very important and pertinent question. We say when we do something again and again, it
Yeah.
leaves a larger imprint on the brain. So one, it is very important to repeat the exercise multiple times in a day to have a larger imprint and stimulus on the brain plasticity. Second thing, your home does not have many machines or tools or aids which can actually help to restore your lost function. So, have considering all the things for patients who are not very sick, institutional rehab or organized rehab with proper goal setting, multidisciplinary team approach is
Yeah.
always better than just physiotherapy at home.
Thank you, sir. So, sir, how often do you see people getting affected for their on their speech part after stroke? What is that one factor which leads to the speech getting affected after stroke? And is speech recovered after stroke even after a few years?
So important thing is there is an area in the brain known as speech area which is located in the left side front of the brain called Broca's area.
Okay.
Impact on that area can cause affliction of both speech and language. With medications, time and speech therapy, lot of patients have been able to recover their speech completely. So
Okay.
that is why if you have post-stroke speech impairment, that's a completely recoverable process.
Okay.
But you need diligence, effort in therapy, and effort on the part of the doctor to give you the right medication.
So nowadays we hear a lot about robotics in rehabilitation. Okay, so in metro cities you do find institutes which provide you robotic rehabilitation for patients. But I'm sure there are people who do not have access to such kind of advanced technology. So first question to you is regarding this is how effective is robotic rehabilitation in the recovery post stroke, and secondly, if people do not have access to such advanced centers, is how do they go about getting benefits of this?
So we are setting up this Mirengo Asia Institute of Rehabilitation Technology along with MedGence. That is going to be a robotic rehab center. A lot of people are realizing that what body cannot do, robotic structures can help the body to perform,
Okay.
providing brain the relevant feedback mechanisms which are required for the brain to change its current flow to
Okay.
increase neuroplasticity and recovery. Here we combine brain awakening medicines, which can actually also aid the recovery of speech, mental function, bodily function. So, to make a combination of all this is imperative
Yes.
for stroke treatments.
And what about the people who cannot access to these advanced center?
What did you say? I missed it, ma'am.
What about, sir? There are rural areas wherein these technologies are not available. So, what do you suggest for such people?
So, very relevant question, Dr. Vichita. In a country like ours, if you have a physiotherapist, simple physiotherapist, you learn the therapy that he does, and your family members can repeat that therapy with you 3 to 4 times a day. That can go a long way in stimulating neuroplasticity. The big
Yes.
part of rural cities and areas are that they may not have the machines, but they have very caring and affectionate family members who are willing
Yeah.
to spend their time on their family and kin to try and help them to get better.
Yes. And also, sir, technologies like telerehabilitation with which MediGence has, we can reach out to the areas wherein we can reach out to people beyond physical borders. And as you rightly said, we can involve the family members and teach them the correct way of dealing and helping these patients so that they recover like someone who has access to advanced centers.
So, to actually facilitate that, we have started online rehab consultations where our trained team can access those patients, understand their current condition, and provide them rehabilitation guidelines for a better and faster recovery. So, at Mirengo Asia Hospitals, we are committed to round the clock 360-degree stroke care, and we can actually start video consultations, online consultations for such patients who want to but are not able to access proper stroke treatments.
Okay. So, sir, what is the role of nutrition post-stroke in in helping you get back to functional independence along with rehabilitation?
No discussion on any disease can be complete without the discussion on what to eat, how to
Yes.
make your body stronger. So, if
Yes.
I have to make my lost muscles better, I need protein. So, I
Yes.
need protein to be eaten and strength training to build that protein into muscle.
Yes.
Also, I need to avoid very fried and fatty foods, take very measured amount of salt, and encourage increased use of green leafy vegetables, whole grains, dalia, khichdi. So these are the
Yes.
things that we can actually increase in our diet to create a balanced diet which has taste and health benefits combined.
Yes. And for people who have other comorbidities like some renal issues or cardiac issues, they must obviously get in touch with nutrition or dietitians so that they can be guided for a correct nutrition post stroke.
Very well said, madam. everybody's diet is different, everybody's needs are different. So
Yes.
it is our responsibility as healthcare workers to tailor our thought process
Yeah.
to the patient's thought process and then to feeding experts who can finally decide what diet is the best for this patient.
Okay. Very, very well said, sir. So, sir, on getting on to a closure note, what message would you like to give patients to feel recovery is possible post stroke?
So my messages are three. One, acute stroke can be reversed and
Yeah.
your life can be made better. Recognize stroke signs and reach a stroke center ready like Marengo Asia hospitals immediately. Second, modify your lifestyle so that we can encourage stroke prevention.
Yes.
Get regular checkups and do not give up.
Yes.
Continue to work on your body and stimulate your neuroplasticity so that your brain and body can work in tandem to recover
Yes.
you. On the exact seat where I'm sitting, I had a gentleman sitting with me 1 hour back who had complete loss of function in all limbs about 1 year back. And yesterday he came after driving his car alone, walking to my OPD, which tells us that if there is a will, there is a way, and we are there to support you at all points of time in your journey of health from prevention to rehabilitation.
Thank you so much, sir, for that insightful chat with you. I'm sure the viewers must have got some very good information regarding prevention and obviously how do you recover post stroke. To our viewers, MediGence and Marengo Asia, along with Dr. Gupta, are there to support you from recovering after such a catastrophic incident. And please keep in mind that rehabilitation post stroke is very important so that you get back to functional independence as soon as possible. Thank you, Dr. Gupta, for your time.
Thank you, Dr. Vishta.